The news of the Biden administration buying 100 million additional doses of the new Johnson & Johnson vaccine may have Iowans hopeful of getting their shots soon. But the governor today reminded people that it could still take some time, and it could still be a few weeks before Iowa sees some of that additional supply. Political Director Dave Price joins us now to go more in depth about the governor's announcement today. Yeah, this is all good news, but we kind of have to temper the expectations and wait for these doses to arrive.
Totally, got to have some patience with all of this. And this is a good reminder with the Johnson & Johnson in that last week the governor's saying we got almost 26,000 doses out there, and it went primarily to workers in those larger plants, 51 of these counties and 51 of these companies in 17 different counties. And it's largely people who work in those food processing plants, meat packers, those kind of things, some of the agricultural mass production centers. Single dose, they can get in there quickly, and a lot of those folks work very closely, so they wanted to get them immunized. The problem with Johnson & Johnson is they didn't get any of those doses this week and might only get about 4,000 doses next week. So there's no way to ramp this up to a larger scale effort. In April, though, the governor is saying that she expects production to really start picking up with Johnson & Johnson. They have that partnership with Merck, so they can make more of this and more quickly. So she's thinking April. That might be the time on your calendar to really watch for when the state can reach that point where basically anybody who wants to get a vaccine could be eligible to get one.
So when we talk about the existing supply of Moderna, the Pfizer, the 2-dose, we know that the state has opened up the eligibility list substantially.
No doubt.
But then also talking a little bit about how this is, I guess you'd call it the honor system that Iowans have to follow to get a dose.
And if you start going through all of those medical conditions according to the CDC, you find that most Iowa adults fall under one of those categories. And a lot of it, let's be honest, is weight. You go all the way down the list and the BMI, the body mass index, is 25. Most people in our state reach that at least and are above that. So you start going through the categories, you're talking about the majority of Iowa adults already qualify. So it's just a matter of whether their county has enough supply, so they're starting to take your appointments for this, or maybe you can find a neighboring county that does it, or a private pharmacy that does it. But most people are already eligible according to this. The governor's saying they can't just let everybody be eligible yet because the supply still is not there. So that gets us back to April, where you need to look at that on the calendar. But to your point, this really is about the honor system. For the most part, unless you're going to your own provider who knows your private history, they're not going to ask you to say, really, are you sure you're 25 BMI? You look about a 22 to me. You know, nobody gets that personal. And there's no punishment or anything for this, but at the end of the day, they're hoping that you assess this situation honestly and realize that other people may be at a higher risk than you are, so just wait your turn, and you may not have to wait that much longer.
Sure, April, I mean, that's right around the corner.
Yeah, it could be April or May, right?
We're talking about not just vaccine supply, but then the equipment and the supplies that are needed to actually extract the vaccine. I know that gets a little scientific there, but there's some good news on that front.
There is, and so the Iowa Department of Public Health Interim Director Kelly Garcia was explaining this to me this afternoon. They are sending out new equipment, and the equipment comes out with the doses that come in those little vials. And because they now have better syringes, those syringes, generically speaking, just suck the liquid out of there, right, before they stick it in your arm. So the better equipment allows them to suck out one additional dose per vial on all three types here. So with Johnson & Johnson and Pfizer, you now get 6 doses per container instead of 5. With Moderna, it's 11, and it used to be 10. So when you think about all of those vials that come to the state of Iowa, just getting one more dose out of there, you can see why this now enables them to vaccinate a lot more people more quickly.
Yeah, that one extra dose, all of those doses add up.
Without a doubt.
Okay. Political Director Dave Price, thanks for joining us, and we will be right back with more after this.